Nowadays, we have more jobs for HCC coding. So, whenever a coder goes to interview, most of the time in the interview, they will ask you about latest HCC coding updates. As all of us know, in HCC coding, we will not use all ICD-10 CM codes. Only few codes we will use. In today's session, we will learn ICD-10 CM HCC coding 2026 updates which are exclusively used for HCC coders. So, if you want to master HCC coding updates of 2026 and you want to clear your interview, please watch this video until the end. On our channel, already I have created one video related to complete ICD-10 CM 2026 updates. If you are not a HCC coder, watch this video. First, we will see newly added codes. So what are the codes added and which will affect HCC coding mostly? First one is C50.AX, inflammatory breast cancer. Right side, left side and unspecified. So basically here we have specificity for breast cancer and the more specified is inflammatory. Okay, so basically patient is having breast cancer as well as inflammation. So usually in the documentation we may see it as IBC. And also we have specificity related to laterality also, right side, left side and unspecified. Next one is E11.A, type 2 diabetes mellitus without complications in remission. Whenever you want to code diabetes mellitus, as usual, we will code E11.9 without mentioning of remission. But if the documentation includes type 2 diabetes mellitus in remission, we need to use E11.A, which is the new code from 2026, which we need to use from October 1st, 2025. Basically here, if you want to code this E11.A, we need to check the documentation. So if the documentation is having in remission, we can code this one, E11.A. If the documentation is unclear about the remission, we need to provide the query to the provider. And also try to remember, remission is different, resolved is different. So remission means still patient is under treatment. Resolved means so it is completely resolved, patient does not have any diabetes now. So don't get confused with remission and resolved, both are different. Next one is G71.036. So limb girdle muscular dystrophy due to Fuctin protein dysfunction. So basically, few people have muscular dystrophy or deterioration of the muscle due to Fuctin protein dysfunction. So that time we need to use G71.036. So basically, which is the muscle related dystrophy. Next one is I27.84X, Fontan related circulation. So as the code itself indicates, this condition is related to circulatory system. Next one is L98.43X to L98.470 447X and L98.A triple X, non-pressure chronic ulcer. So basically we have few codes or few new codes created for non-pressure chronic ulcer, and also they have provided sites related to these non-pressure chronic ulcer, which includes abdomen, chest, neck, face, groin, upper arm, forearm, hand, with laterality and severity added. So if you have missed this course, watch our complete ICD-10 CM 2026 updates video, where I have provided each and every code in the video. Just here, what do you need to remember? We have pressure ulcer as well as non-pressure ulcers. Pressure ulcer most of the time related to bed-bound people. Non-pressure ulcer anyone can get. Next one is M05.A, abnormal RF and ACPA with RA. So basically this is related to rheumatoid arthritis. So if the patient is having abnormal rheumatoid factor with RA or rheumatoid arthritis, we need to code M05.A. Next one is T36.A into 2 into poisoning fluoroquinolone antibiotic intentional self harm. Okay, so basically intentionally the patient will get harm due to fluoroquinolone antibiotic. As it is a antibiotic, most of the time we will use it for infections. You need to code T36.A into 2. And next one is T65.842 in X. So toxic effect of xylazine intentional self-harm. So all are basically intentional. So first one is also intentional fluoroquinolone antibiotic, and this toxic effect is also intentional. Means intentional means patient wants to harm him or herself. So that time only we can use these two codes. So if the patient is having toxic effect, so what is toxic effect? So contact with chemicals. Okay. So that time we will use T65.842X. Next one is H40.84X. Neovascular secondary angle closure glaucoma. So neovascular means neo means new, vascular means related to blood vessels. Okay. So as glaucoma is the increase in the intra-articular pressure, if the patient is having angle closure glaucoma due to neovascular, we need to code H40.84X. And we have few expanded codes exclusively related to HCC coding, which are D71 point into RX, which is functional disorders of polymorphonuclear neutrophils. So basically expanded code means already we have these codes, but they have expanded by providing more characters. So next one is E72.53X, E72.54X, primary and secondary hyperoxaluria. So what is hyperoxaluria? So basically patient will have oxalate crystals in the urea. So that time you will use E72 series. Next one is G35.A, G35.BX, G35.CX, G35.D. Multiple sclerosis subcategories. So previously we don't have uh, subcategories related to multiple sclerosis, but October 1st, 2025 onwards, we need to check the documentation for subcategories related to multiple sclerosis, and if we find, we need to code this. Next one is E78.01X, familial hypercholesterolemia. So previously we don't have any specificity related to hypercholesterolemia. Now we have specificity related to hypercholesterolemia, where we will use E78.01X. So these are the summary of ICD-10 financial year 2026 updates on HCC. Okay, so CMS HCC diagnosis. Next column is the ICD-10 codes and changes. So inflammatory breast cancer, ICD-10 code C50.AX added. Functional disorder polymorphonuclear neutrophils, D code is expanded, and type 2 diabetes mellitus without complication remissions is also added. Primary and secondary hyperoxaluria expanded. So expanded means already we have the code, but this year they have expanded. Multiple sclerosis also expanded. Limb-girdle muscular dystrophy also added. So this is the new code. So font and related circulation is also added. And non-pressure chronic ulcer, new sites and severity is also added. Abnormal rheumatoid factor and anti-citrullinate protein antibody with rheumatoid factor is also added. Poisoning by fluoroquinolone antibiotics and toxic effect of xylazine intentional self-harm, these are also added. Okay, so now onwards we need to check for more specificity related to all these conditions. while you code HCC coding charts. So thanks for visiting our channel. I hope this session will be very useful for you. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG coding training, HCC coding training, CCS certification training, or if you are looking for APC renewals, please contact 707 526 3939.